Assalamu alaikum. My name is Rashida Batul, BP 1650185. The drug assigned to me was fluorescein sodium, which is a diagnostic agent. Fluorescein sodium is marketed as fluorescite eye drops. What is fluorescein? Fluorescein, as mentioned earlier, is a diagnostic agent which is used mainly in the field of ophthalmology and optometry. There are two forms. It can be either applied topically in the form of drop, or it can be injected intravenously to produce a fluorescein angiogram. Rational use of drug. What is rational use of drug? According to WHO, rational drug use means the patient receives the appropriate drug according to the medical needs or medical requirements of the patient for a required period of time. The frequency and dosing of the drug should be appropriate according to the medical condition of the patient. The price of drug should be low. Why? Because if the drug prices are high, the patient will leave the medication in between due to financial crisis and the treatment will not be completed, which can cause serious health hazards or which can cause worsening of the condition of patient. Now, what is irrational use of drug? Irrational use of medicine or non-rational use of medicine means that the medicines are used in a way that is not compliant with its rational use. Now, WHO says that more than 50% of the medicines are prescribed, dispensed, or sold inappropriately, and half of all patients fails to take them correctly. The overall excessive use, misuse, or incorrect use of the medicine result in the wastage of resources, and it also leads to widespread health hazards. Irrational use of drug includes polypharmacy, that is, use of more than one drug that is not required in that particular condition. Secondly, inappropriate use of certain antimicrobials, inappropriate use of inappropriate use of injections or overuse of injections when oral formulations are more appropriate, failure to prescribe in with proper clinical guidance, inappropriate self-medication, dispensing of medication without prescription, and non-adherence to dosing regimens. Rational and irrational use of fluorescein. Fluorescein, as mentioned earlier, is a diagnostic tool. That is why the rational use of fluorescein sodium is for diagnostic imaging, primarily indicated in diagnostic fluorescein angiography or angioscopy of fundus and of the iris vasculature. Now, what is irrational use or inappropriate use? If fluorescein is used more than the dose recommended, it can cause to severe allergic reactions that are irreversible. Apart from that, sodium should not be used in patients with hypersensitivity to this diagnostic tool. Now, available dosage form of fluorescein. Fluorescein are available in two dosage forms. Number one, fluorescein is available in the form of drops and in the form of strips. That is, fluorescein we can apply it topically, but the conditions in which we use fluorescein drops and strips are corneal aberrations, corneal ulcers, hepatic corneal infections, and dry eye. The other available dosage form of fluorescein is in the form of fluorescein injection. In the case of the diagnosis of macular degeneration, diabetic retinopathy, inflammatory ocular conditions, and intraocular tumors, we use fluorescein sodium intravenously to produce a fluorescein angiography. Now, dosage of fluorescein and the alternative brands that are available. Dosage depends upon the age of the patient. In adults, including the elderly, one 5 ml ampule of fluorescein sodium, that is 100 milligram per ml, is to be injected intravenously. In pediatric patient, the dose is adjusted to 35 milligram per 10 pounds of the body weight of the peds. In dialysis patient, the dose is reduced to 2.5 ml, that is half ampule, as an intravenous injection. No certain dose management or dose compromisation is seen in renally impaired patient other than those of dialysis patient. Now, fluorescein are available in different brands in different forms. Like opt fluoro strips are available in the form of strips which are applied to the eye. It is available in the form of 25 pieces in a packet of 2, and price is very reasonable, that is 100 rupees. Second, we have a fluor, which is known as Fluorescent Injection USP. It is an injection solution and is available in the pack of 12, and it is very costly. That is about $546 or 40,000 Pakistani rupees. But these injections are not available or very rarely available in Pakistan due to its high cost. Adverse reaction and complications that are associated with fluorescein sodium is the common side effect of fluorescein sodium includes skin and urine discoloration. That is, mostly bright yellow urine appears if the patient is using a fluorescein diagnostic tool or strip. Secondly, gastrointestinal reactions like nausea and vomiting is very common. Fluorescein use is contraindicated in patients with history of allergic hypersensitivity to fluorescein. Generally, fluorescein is safe, but patient receiving dialysis, the dose is reduced to avoid any incompatibility. If there is any allergic reaction such as pruritus or urticaria, it can be treated with antihistamines, but any patient who experiences these symptoms should be observed carefully so that no possible anaphylaxis is developed. Those severe reactions are rare, but if there are any severe reactions, these include laryngeal edema, bronchospasm, anaphylaxis, tonic-clonic seizures, and myocardial infarction, including cardiac arrest. Drug-to-drug interactions. There are no as such drug interactions of fluorescein observed, but by the use of fluorescein with the use of fluorescein in other along with other drugs, there could be an increase or decrease in the excretion rate of either fluorescein or the other drugs induced by the fluorescein. Now, there are 4 different drugs. Number 1, drugs that may increase the excretion rate of fluorescein sodium and could result in lower serum level along with reduction in the efficacy. These drugs includes dexamethasone acetate and dexamethasone. And its second class is drugs that may decrease the excretion rate of fluorescein sodium. If we give fluorescein sodium along with enalapril, furosemide, folic acid, methotrexate, vincristine, vinblastine, maclophenamic acid, or tolbutamide, then it may decrease the excretion rate of fluorescein sodium. Third category is drugs that may increase the excretion rate of fluorescein sodium, but it does not affect the efficacy or it does not lower the serum level. These drugs include methyl testosterone, phenobarbital, or taurocholic acid. Fourth class is drugs whose excretion rate is decreased by fluorescein sodium, which results in low serum level. These drugs include paclitaxel, naproxen, nitrofurantoin, ofloxacin, ranitidine, lipogliclide, and sulfamethoxazole. Study. A previously healthy 35-year-old man presented to a local acute care clinic for the evaluation of conjunctival irritation in his right eye. During his examination, fluorescein was placed using a fluorescein-treated ophthalmic strip and normal saline. His examination at that time was considered normal. That is, there was no such adverse reaction or any sort of complaint. Within 30 minutes of leaving the appointment, he began to notice approved pruritic rash around his right eye and on his arms, chest, and legs. The patient also noted that his joints felt swollen. He presented to the emergency department 6 hours later because his joint stiffness and skin irritation was still there. During the interview, he denied recent chemical exposure except for fluorescein strip and normal saline. He also denied past exposure to fluorescein medical or any environmental allergies and medication usage. On physical examination, he was noted to be normotensive with no tachycardia or tachypnea. A diffuse erythematous and macular rash with evidence of moderate excoriation over his upper and lower extremities was noted. His wrists and ankles were swollen. No oral lesions were noted, and his laboratory studies or tests include only WBC count with differentials, which appeared to be normal. The chief complaint of the patient was pruritic rash around his right eye and on his arms, chest, and legs, swollen joints, and joint stiffness, skin irritation even after 6 hours. His history includes no such chemical exposures or any sort of exposure to fluorescein before this issue. He was there in the clinic because of conjunctival irritation in his right eye. Age of the patient was 35 years and he was a male patient. Physical examinations concluded that he was normotensive with no tachycardia or tachypnea, diffuse erythematous and macular rash with evidence of moderate excoriation over his upper and lower extremities were noted, and his wrist and ankles were swollen. Lab tests included differential WBC, which comes out to be normal. This whole study of the patient assessed that patient suffered due to adverse reaction of fluorescein sodium, or might be he was allergic to fluorescein sodium. He was treated with methylprednisolone succinate 125 milligram and diphenhydramine 50 milligram. The dose of prednisone was tapered, which resolved his symptoms within a week. That is, after a week, a follow-up was there in which the patient tell that his symptoms were resolved completely. This whole case study concluded with that adverse reaction due to fluorescein sodium is very rare. Ocular comprise complaints were only up to 10%, and sterile fluorescein impregnated strips were commonly used as a part of the diagnostic workup for these complaints. And predominant side effects of topical fluorescein dye is local irritation and usually in the form of burning sensation in the eye. Systemic side effects to intravenous fluoresceins are very rare, but if there are any, these includes urticaria, dyspnea, pruritus, vomiting, and rash compromise the bulk of these reactions, which are well covered in the medical literature. Fluorescein is normally not very hazardous or not very life-threatening, but severe allergic reactions in certain patients, which is very rare, can cause a health hazard condition or a very serious condition of the patient. That is all about fluorescein sodium. Thank you.